You need to grab a bottle of saline for these on the sides.
Do you want me to refill it, please?
I don't think I'll need much more than this. Yeah, thanks. That should be enough. Here it reminds that we could put some PPE on. It's not a bad idea anytime you're caring for a trach. Someone might cough and you're in here cleaning like this, looking down the barrel of the gun. I'm going to perform hand hygiene, introduce myself to the patient, and explain the procedure. So, Mr. Smith, we just suctioned out your airway. I'm looking and I'm needing to change the dressing around your tracheostomy tube. I also want to do my shift assessment on the skin around the tube, and those ties look kind of dirty, so we'll just go ahead and change those out while we're here. And I'm also going to be cleaning out the inner cannula on the inside and making sure that that's clear and patent for you. All right? So we'll set up our supplies, carefully open our kit. Inside, we have our gloves, which we can carefully pull out. There's a sterile drape inside, which I'm going to use it, because why not? You can grab these with clean hands and use the 1-inch border of the drape to open it up. We're always taught shiny side down for these. I have no idea why that's the case.
Because if you put it on the shiny side, it runs off.
Yeah.
It's coated.
The shiny side is water resistant?
Yeah.
Oh, see, you learn new things every day.
It's an absorbent side is the
Got it.
shiny.
All right, taking stock of what I have in my kit, these are all currently sterile supplies, so don't go rummaging through the Doritos bag. There's a fresh split gauze in there for changing and leaving around the trach. There's some plain 4x4 that you can use for cleaning. There are pipe cleaners. There's a bristled brush for scrubbing the cannula. There's a couple of swabs as well as a little basin for sterile saline. So similarly to before, be very careful, come around, and from the side, pour your saline into the basin that's empty in the kit.
In your checklist, it says peroxide and saline, or just doing saline.
Yeah, I don't think we're using peroxide. Okay, is my kit adequately set up? Am I ready to put on my sterile gloves? No, I'm not. Just like the central line dressing, we've got some dirty. We want to remove the dirty before we put on our sterile gloves. Okay? So I'm going to put on some clean gloves, reaching behind you here.
And he's already wiped the surface again, right, when he restarted?
Didn't you see that? I wiped it good.
So fast, too.
Okay, clean gloves to start. I'm going to loosen up your oxygen source here, and we're going to take, can you give me that inner cannula, that thing that I had you take away before? Thank you. This is an important part of this skill. Keep this nearby in case you need it, but you can loosen the straps on the mask and just have that draped to the side. So you're going to find your patient in this condition, and what we're going to do is, number one, we're going to take the inner cannula out. So whether it's a clip on or a screw on, we're going to take this inner cannula out and remove it. When you remove these, they're curved, and so go with the curve, right? If you pull like this, it's just gonna, it can be irritating. You can malposition the tube. So we go with the curve, take out the inner cannula, and carefully take this thing and set it in the clean saline, the sterile saline, right? Don't let it touch all of your cleaning supplies, just into the soaking basin, all right? And then we're gonna remove the dressing, pull this down, careful not to remove the tracheostomy tube. When you're removing the dressing, it's got some yellow, brown drainage on it, mucus. This is garbage. I'll throw that away. While I'm here, I've now exposed the tracheostomy site. I can assess the site. When I'm keeping a grip on the trach, I can actually lift what this is called the flange, and I can assess the skin. Okay, everything's intact there. I don't see any redness or breakdown or sloughing or anything like that under there, so that's good. There is a little bit of dried, crusty goo under there, so we'll clean that off. But the inner cannula is out, the dressing is off, and now I'm ready to put on my sterile gloves and get to cleaning. I'm gonna take these off. I don't know if I'm really gonna end up using this sterile drape, but I kind of like not having it in my kit and getting in the way. Using all of my real estate on this table. You get 2 sterile glove opportunities.
And you did hand hygiene in between too.
I sure did.
Faster than the speed of light.
Yeah, you guys better start paying attention. Pinch, scoop. Get the thumb out of the way. Sterile gloves are on. Now I'm going to direct my attention first to the inner cannula. We're going to clean this with a couple of different tools. One, we're going to scrub it on the inside. Scrubby, scrubby. Right, you can use the sharp bristles to brush off any goo here.
But no soap or anything, just the
No soap, just saline.
Okay.
And that left hand now is no longer sterile?
So the only part of this procedure that remains sterile is this action right here. I pick up my cannula, I scrub it clean. It's important that we dry this. So you got a couple of options here. You can use the dry pipe cleaners to dry the inside. Maybe we want to do it long ways. If it's dripping with saline and you put it into their trachea, they're gonna cough and be uncomfortable. You can dry it this way. You can tap it dry. Does it say to tap dry on the, yeah, you can tap dry on the sterile gauze over here.
Tap on sterile gauze to dry.
You just don't want it to be dripping. It doesn't need to be completely dry. This is ready to go back in the patient. And now that it's clean, I just don't want to touch it and get it dirty. It's going to go right in, clipped on. I'm done with sterile. I'm done with sterile. I now want to take, I like to do 2 things. One, grab my cotton swabs, maybe get a little saline on those. Come over here and clean the peristomal skin. Scrub off the dried blood or the crusted mucus that's on the outside. Maybe we get rid of that. Maybe we do one more and we actually clean the tube itself.
Is this part sterile right now?
No, nope. The only thing that's sterile is the inner cannula that's going inside. All right, so I've cleaned out around the skin. I've cleaned off the trach tube itself. I can use my 4x4 to dry the skin, dry the tube. If you notice, I'm being pretty careful with my non-dominant hand to hold the trach in place when I'm not coming in here and just being really floppy with it. I'm trying to keep it secure. And then I'm ready to put the dressing on. Come from below. It's a lot easier than going from above, and drainage likes to go down. So you want to come from below. You're going to need to lift that flange a little bit. Just take your time and be careful so you don't pop the trach out when you do this. Bring the flaps up on one side, and then bring the flap up on the other side. Try and get it to look neat, like that. Clean inner cannula, clean dressing, clean tube, clean skin. Now we need to change the ties. There's a clean pair of ties on here. The principle here is do not leave this trach unsecured. So we recommend that you put on the new ties first before removing the old ones. Bring it around. You get to practice your
fine motor skills.
sailor knot tying skills and your fine motor, yeah. Alright, maybe I'll do that. And then over here, we do this. We can,
There's not a perfect knot in this, just so
There
you guys
isn't.
know.
Okay.
yeah,
And in the real world,
It's like, I don't know how to
they're
do this.
Velcro, you'll see a couple of them
Yeah.
have the Velcro style.
tie a little knot there
Do you double clove it?
on one side and then pull through. Now the tightness matters, right? You do not want to cinch this down. Some people aren't into that. And do you know how tight? Does
1 finger.
it say 1 or 2 on the checklist?
I don't know that it says. It is 2 fingers from what I remember.
For 1 or 2.
1 or 2? I guess we all have different size fingers. The point here is that you should be able to slip your finger through this gap, or else it's too tight. And if it's too loose, if you can stick your whole wrist through it, it's too loose, it's not securing the tray. So you just kind of do your best here to tie a little knot. That's not supposed to fall out. As long as there is at least 2 fingers of a gap, you're good. Now the old one can be removed. And our trach is clean and secure. You're all good to go, Mr. Smith. You can apply your trach mask back on for humidification. Make sure does it have a reassessment step? I mean, you were just in here messing around with their tracheostomy tube. Let's make sure that assess patient's respiratory status. Make sure you didn't dislodge anything or SATs look good. You're on your baseline amount of oxygen. You're feeling okay. You can nod your head yes if you're breathing okay. Great. All right, I think we're done, Mr. Smith. Leave the patient in a position of comfort and safety. And I believe that's the end of the skill.
It says on there for the gauze, right? Use the pre-cut or the fenestrated. Why is that?
Mm.
So if it's not in our kit, can we just grab a 4x4 and cut a slit in it? Why?
Fibers?
Yeah, all the fibers and everything, right? So you have to make sure they're drain sponges or fenestrated, and that's the right way. It seems like it would go on easier because it is easier to apply the other way, but you'd see a lot of times just the 180 of that or the
Pointing down,
exactly
opening at the bottom, and then
Yeah.
it just drips down their chest.
Yeah.
And the pipe cleaners don't